Hi, I'm so delighted to meet you in the program of 1 Minute Please. What is meropenem? So, we often use meropenem in various clinical conditions, but I would like to reiterate some facts about meropenem. So, meropenem is an carbapenem antibiotic. So, what is the bacterial spectrum? We often consider meropenem is a potent gram-negative antibacterial. Of course, it acts against gram-negative bacteria very vigorously, but what you have to remember that it is capable of acting against gram-positive and gram-negative, and to much our surprise, even against anaerobes as well. So, please remember that it is active against gram-positive and gram-negative and anaerobic bacteria. There are few bacteria which resist against the antibacterial action of meropenem. For example, among gram-positive, if you suspect MRSA, methicillin resistant Staphylococcus aureus, then probably meropenem should not be given. And meropenem is inherently less active against Enterococcus faecium and Enterococcus faecalis. These three organisms generally is able to resist against the action of meropenem: MRSA, Enterococcus faecalis and Enterococcus faecium. And among gram-negative, so against most of the gram-negative bacteria, it acts well. But of late, because of indiscriminate use of meropenem, there are emergence of resistance against meropenem. So, namely, Enterobacteriaceae organisms including E. coli and Klebsiella and Pseudomonas. These organisms produce particular enzymes, that is so called carbamase, which hydrolyze this carbapenem antibiotics, I mean meropenem. So, please remember that that's called EKP, that's E. coli, Klebsiella and Pseudomonas. They produce various type of carbamase enzymes including KCP and New Delhi metalloproteinase and OXA48. These are the enzymes produced by these EKP organisms, and that simply hydrolyze the meropenem. So, these are the conditions where when you suspect the carbamase producing Enterobacteriaceae, then probably meropenem won't act well. So, what are the areas where you can give meropenem liberally? Meropenem is able to penetrate meninges. Only few broad spectrum antibiotics can penetrate meninges. Meropenem is one among them. Meropenem is able to penetrate meninges, that's why it is indicated in meningitis. Next, if you come down to lungs, yes, it can be given in community acute pneumonia when somebody presents with shock, and hospital acute pneumonia. And if you go down further, yes, it is indicated in complicated intra-abdominal infection and gynecological infection and complicated skin and adjacent structural infection. But among these areas, when you suspect community acute, so generally meropenem should be reserved. In the sense, then you have to hold back the administration of meropenem. Generally, most of the community acute infection can be treated with the antibiotics which is less aggressive than meropenem. When somebody presents with community acute infection in the state of shock, then probably meropenem can be indicated. For example, community acute pneumonia, if they present with shock, then probably I think that you are justified to give meropenem. Otherwise, you have to choose the antibiotic which is less potent than meropenem. Something like that UTI, if it is not hospital acute, then probably you can go for piperacillin as compared to meropenem as an initial choice to avoid antibiotic resistance. Then what are the side effects of meropenem? So, generally meropenem is relatively less harmful. Like any other antibiotic, it can produce diarrhea and vomiting, and we have witnessed many cases of thrombophlebitis as well. The most important side effect, but rare, is seizures. So, when somebody has history of seizure disorder, then you should be very wary about administration of meropenem. And moreover, meropenem can induce seizure in a seizure disorder patients and as well as in renal insufficiency patient. That's why meropenem should be adjusted based upon eGFR. Those who are taking valproic acid, you should be very careful about administration of meropenem, because meropenem will reduce the efficiency of valproic acid, resulting in seizures. So when somebody is on valproic acid, either you can avoid meropenem or you have to use very judiciously. And how you can give meropenem? So most of the time what we witness, meropenem is given as an IV injection as a stat. So better to give as an infusion. So meropenem supposed to be given over 3 hours, because meropenem should be given 8 hours once. So in many times it is often given meropenem twice daily. Please avoid it. Meropenem should be given 1 gram IV 8 hourly if renal function is good. So when meropenem is given 8 hours once, then why we give prolonged infusion, especially over 3 hours? Because we are supposed to maintain minimum inhibitory concentration between the doses. So if you give something like, if you give as a stat dose within 5 minutes or 10 minutes, what happens? You are not able to achieve the minimum inhibitory concentration over a period of time. So it's say at least 60 to 70% of the interval time should be maintained with minimum inhibitory concentration of meropenem. So it should be given over 3 hours. How will you identify meropenem resistant bacteria? So when you order blood culture, specifically mention blood culture identification panel, where it not only identify the organism, then it would say that whether that organism produces carbamase enzymes including OXA48 and KPC and New Delhi metalloproteinase. So take a message. Meropenem is a wonderful antibiotic that can be active against gram positive and gram negative and anaerobic, but it is not able to execute its wonderful action against few bacteria including MRSA and Enterococcus faecalis and Enterococcus faecium and carbapenem resistant Enterobacteriaceae including E. coli, Pseudomonas and Klebsiella pneumonia. Meropenem should be given as prolonged infusion, say 3 hours, and meropenem should be used very judiciously, especially in hospital acute infection. If somebody presents with community acute infection, if they present with shock, and I think that you are justified to give meropenem, please remember that meropenem is an omnipotent antibiotic, but it should be handled judiciously. Thank you.